Don't wait for the government to tell you what to do. Do the right thing now.
Calgary's mayor is encouraging people to take immediate action to contain the spread of COVID-19 before the Alberta government has to put more restrictions in place. 907 new cases were confirmed today in that province, the second highest daily count of the pandemic. Many of us have COVID-19 fatigue, but those on the front lines have a message. This disease isn't going away. Healthcare workers have the burden of taking care of the sick and, in some cases, watching them die. But their own lives are also on the line. Here's Heather Yourex-West.
Each night, it was a chance to say thank you, a noisy salute to the healthcare workers treating COVID-19 patients on the front lines. But 8 months into this pandemic, in the thick of a second wave, Calgary Dr. Joe Vipond doesn't hear those nightly tributes anymore.
And back in the spring, there was this feeling that all of society was behind us, that yes, you are endangering yourselves, but you know what? We're all willing to step up and play our part. And I think the harder part for us today is we no longer have that sense of solidarity with the rest of society.
Instead, doctors in several provinces feel at odds with policymakers who are now balancing economic concerns with the issues around public health.
We really have a recipe of, number one, psychological and emotional trauma, and number two, a risk of them getting sick or being quarantined.
According to the Canadian Institute for Health Information, more than 21,000 health workers were infected with COVID-19 during the country's first wave. 12 of those workers died. Since then, there have been another 915 infections among health workers in BC, more than 1,800 in Alberta, 69 in Saskatchewan, 2,096 in Ontario, and more than 7,000 in Quebec, where another 10 health workers have died.
Physicians are tired.
The Canadian Medical Association says it's time for the country to return to the mindset we had last spring.
So we're 8 months into this pandemic, and Canadians are on the whole, are tired of hearing about it. But the fact remains that this is a virus that kills people, and we're seeing that now.
And with hospitals in several parts of the country approaching capacity, the need for a fresh sense of solidarity has never been so great. Heather Yourex-West, Global News, Calgary.